Perfect. All right, welcome to Deuk Spine Institute. Stay there, everybody. Our patient comes from Mississippi, and he has a herniated disc at C6-C7. He has a very thick neck, so he's one of the hardest that I can possibly do. What we're doing is laser spine surgery. It's done through the front of the neck. It's done with a 4mm skin incision, tiny, Band-Aid type incision. It's ultra minimally invasive. And he did not want fusion. He has a large disc herniation at C6-C7. It's pinching his left C7 nerve root, causing horrible pain in his neck, but some headaches and cervical brachial pain, and also cervical radiculopathy. He's losing function in his left arm. So we found Deuk Spine Institute. He did the MRI review, and he's here now to have our Deuk laser disc repair. Sean? Again, this is on the scale of 1 to 10, this is a 10 plus surgery. All right, get an AP. 2. Let's count from the top. 2, 3, 4, 5, 6, 7. Henry, let's show the audience while we're getting into the disc how a disc injury can become so painful, move those rays, for a patient.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back, folks. Now you've seen how disc injuries from trauma tear the wall in the back of the disc, and they cause a annular tear and disc herniation. Sean? Now we're going to show you how we fix them endoscopically with a laser.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. So you see in the video that we go through the disc. The disc is fine. There's nothing wrong with his C6-7 disc. The problem is at the back of the disc where the herniation is. We've made a 4mm incision in the front of his neck. I've put my endoscopic tube all the way down through the disc to the back of the disc where the herniation is. I'm going to use a laser to remove the herniation, remove the scar tissue, remove the granulation tissue, and clean the tear so that it can seal itself over. So we want it to seal itself over. That's the purpose of the surgery. Remove as much herniation as we can and clean the annular tear so the annulus will heal. His body is unable to heal the annulus without me doing this debridement. The annular debridement is the procedure that I first described as part of the Deuk laser disc repair. All right, you can see down the tube where in a 2.8 millimeter tube. There's the laser fiber at the top, 12 o'clock. That is a fiber optic fiber, and it will deliver laser energy to the herniation and the tear, and that way we can remove it. Any questions from our audience?
At this moment, no current questions.
Okay, good. I'll just work. In the meantime, if you want to, we've shown them how the disc causes neck pain, correct?
Correct.
Why don't we show the audience the 30 different causes of neck pain that we commonly see. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. 30 causes of neck pain. There are 30 distinct, very specific sources to pain in the neck. And those sources we've outlined in our video. It's taken Deuk Spine Institute many years to figure out the sources of neck pain because, frankly, nobody's known about them until we put it all together here at Deuk Spine for the first time. Now, most people are aware that a disc injury will cause neck pain. This is the herniation right here, by the way, that I'm working on with the laser. Herniated discs account for 90% of chronic neck pain, herniated discs. We also know them as degenerated disc, bulging disc, ruptured disc, protruding disc, extruded disc. So all those names are for the same thing, a disc injury. So the general term we like to use here at Deuk Spine is disc injury because it sort of summarizes all the different types of disc injuries that you're aware of, that you hear about on your MRI reports, such as bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, spondylitic disc, degenerated disc. They're all basically the same thing. And the way they cause pain is you get a tear in the back wall of the disc from trauma, some type of an auto accident, slip and fall, some kind of an injury to your spine. And then that tear allows the jelly stuff, which is this blue stuff right here, to escape. And the jelly stuff squeezes out through the tear and it gets onto your nerves in the back, but it also causes pain through a process called inflammation. If you've ever had chicken pox or if you've ever had pimples, you know what inflammation is. Inflammation is red, swollen, and tender. All right, that's what inflammation is. So there's a non-stop inflammation happening in the back of the disc, right where the tear is, right where the herniation is. As a matter of fact, that's what we're removing right now. As you can see, that laser fiber just removing pieces of herniation. Any questions from the audience?
Yes, we have a question coming from a user on YouTube
Hello, user. Welcome.
asking, is it endoscopic posterior cervical foraminotomy?
This is not posterior. You are seeing an anterior cervical transdiscal. There are very few surgeons in the world that can do this surgery, probably less than 5. This surgery was first pioneered in Korea, South Korea, by Dr. Sang-ho Lee. He was the first to do this. It is the best way to fix a herniated disc. I took his surgery that I learned from him overseas 20 years ago, and I modified it and made it better in many ways. One of the ways I made it better was we started to treat more than one herniation at a time. And Dr. Sang-ho Lee and Dr. Gun Choi, who trained me in anterior cervical transdiscal endoscopic, they were only treating one disc at a time. So you would have to go, if you had 2 discs that needed treatment, you have to go to surgery twice. I found a way to move from one disc up to the next disc or down to the next disc, and I was the first to do that. So I introduced here at Deuk Spine with the Deuk laser disc repair, our version of laser spine surgery. I introduced multiple disc treatment. Okay, that's a bone spur right there. You guys see that? I'm literally zapping away a bone spur. This is herniation up here. There's some more herniation right there. I'm gonna have to turn and go get it. But we've only got a few minutes left. This is not foraminotomy. This is transdiscal surgery. Foraminotomy is done by many doctors, many surgeons. It doesn't work well at all, and it requires the surgeon to remove the bone in the back of the spine called the facet joint, part of the lamina. You get a hemilaminotomy, partial facetectomy. You got to remove ligaments that hold the spine together. You have to remove facet capsule. You have to remove muscle. So you're removing all these normal structures that you need to hold your spine together and for your spine to work in your neck. That's why foraminotomy is so bad. It's destructive, and it's permanently destructive of normal structures you need. It also doesn't get to the herniation very well because the herniation's in the front of the spine, not the back. The foraminotomy is done in the back. It was an old technique developed over 100 years ago, and it's not a very good technique. This is the most advanced laser spine surgery in the world, in my opinion. Everybody's entitled to their own opinion, but my opinion is this is the most advanced because it has the highest success rate of eliminating patient symptoms, and it has the lowest complication rate, and it has the fastest recovery, and it lasts the longest of all other treatments.
We have another question and or seeking advice.
Sure, give me 1 second. I want to say one more thing. With this type of surgery here at Deuk Spine, you are not going to develop what's called adjacent segment disease, because adjacent segment disease is when your other discs degenerate and become painful or symptomatic, okay? Or your facet joints do. The reason why you get adjacent segment disease from a fusion or artificial disc is because those surgeries are invasive. They change the biomechanics of your spine. Got 2 minutes. You understand? They change the biomechanics of your spine. And in doing such, it puts extra stress on the joints above and below the surgery. Now, I've done 1,000 artificial discs and fusions in my career as a neurosurgeon. I've done so many. And what I can tell you is I stopped doing them because people didn't want them anymore. Okay? They didn't want those surgeries done. They're too invasive and too destructive. All right, I have to just take a look this way. So go ahead, Henry. What's the next question?
Next question from Cosmic Knight on YouTube.
2 minutes left.
Asking, Dr. Deuk, I had a slip and fall recently at the grocery store. What
Cosmic.
could be causing my shoulders, wrist, hands, and fingers to be hurting so much? I spent 3 days in the hospital on January 19th. Neck also hurts.
Well, it's a great question, but to be honest, when it comes to trauma, all bets are off. It could be a problem with your joints. It could be a problem with a pinched nerve, either in your neck or your extremity. It could also be a shoulder injury. Honestly, I don't know. I can't tell you based on that history. What I need is more information, and I don't have that information without being able to see some tests. this is the big part of the herniation. You guys see all the pieces coming out? I am literally floating them out of the tube. So what I'm doing is releasing them with the laser, cutting them, detaching them from the scar tissue in the back of the disc. And then I'm floating them out. Luis, the bag is catching me right here, please. Look at all these pieces of herniation. It's amazing, huh? Sorry, Bernadette, it's going to take a little bit longer. I'm finding more pieces. They're just popping out from everywhere. And they're stuck down pretty good. So I'm having to use the laser. Irrigation changed? Yes. Thanks. It's catching again somewhere. I don't know where. Yeah, somehow that was. Any other questions from our audience?
Yes, we have another question from user once more on YouTube. Asking, what if disc height was already decreased? I think ACDF is better treatment plan at that situation. Laser surgery can be done. I'm not good at using English. Sorry, Professor.
No problem. So it doesn't matter how much disc height you lost. You can lose 100%. Laser surgery is always better when it comes to treating neck pain from the disc, so discogenic neck pain, headaches from the disc, cervicogenic headaches, cervical brachial pain, which is pain going from your neck and your shoulder, and cervical radiculopathy or cervical myelopathy. Their only situation, doesn't matter how collapsed your disc is, you don't need your disc material, okay, period. You don't need anything in there. Oh, look at that herniation that just came out of the frame. Did you guys see that?
Yes, we did.
Popped out from where the nerve is. That was amazing. The only time you're going to not be able to do this surgery for any kind of disc issue is when you have what's called OPLL, ossification of the posterior longitudinal ligament. And even then, I've treated some mild OPLL and had very good success with this surgery. So, yeah, Bernadette, I'm finding more herniation. So it's taking me a little bit longer. I'd say probably 5 minutes more. Yeah. I'm communicating with my anesthesiologist, letting him know how much more time I need so he can modulate the anesthetic properly for the patient. Great questions. A lot of people think if you have a collapsed disc, you have to have a fusion or artificial disc put in. I've treated literally thousands of people with collapsed discs, and they do so well with this surgery. It's stuck again. Something is sticky. I think the drape maybe is. Got to fix that. Put a Raytech there or something to absorb the stickiness. All right. Any other questions?
At this moment, no current questions.
Excellent. So we've shown the audience the 30 causes. There's a piece of herniation right there. You guys see that?
Yes, we do.
Try to grab that out. 30 causes of neck pain. We've shown them how disc injuries occur through trauma.
Correct.
And we've shown them how the Deuk laser disc repair works. There's a piece of herniation. You guys see that?
Yes, we do.
Now, it looks big as it takes up the whole tube, 2.8 millimeters, but it's actually just about a 3 millimeter piece of herniation. Okay? But the point is, a herniation is all of these pieces added together. That's what makes a herniation symptomatic. Herniations are never one piece. A lot of people don't understand that concept. Think about marbles in a bag. A herniation is really maybe 20 or 30 marbles in a marble bag. That's how it causes problems, is because it's got multiple pieces that are pushing on the nerves or spinal cord. It's not one piece. I've never seen a herniation with just one piece. Luis, can you help me just a little bit? I'm having his chest is blocking me. This is the last bit of herniation right here, and I'm trying to get as much of it out, as far lateral as I can. His chest is very big. He's a very big, strong guy with a thick neck, a big high collarbone, a big chest. But that's another piece of herniation. We've taken out about 30 pieces of herniation so far. There's another piece, okay? And they just keep coming. So how did these pieces, they used to be part of one big piece of nucleus. How did they get fragmented? The answer is trauma. That's pure and simple trauma. That's how they get fragmented. All right. Any other questions?
Yes, we have about 2 more questions. Next one from Facto on YouTube.
Hi, Facto. I tell you what, let's save the questions. I'm going to come and answer them in person. All right, so type up your questions, folks. We're just about done. And I'm going to come over there and answer them for you face to face. We don't do that a lot anymore. But you know what? I gotta show off my new haircut. Right, Luis?
Oh, yeah.
Luis says yes.
I wonder
High and
if
tight.
you,
Oh my gosh, I'm trying to get this piece of herniation out. It doesn't want to come out.
I wonder if you were motivated by somebody.
If I was what?
By somebody. Like,
What?
you saw somebody and you're like,
A fight?
no, it just
Okay.
looks like Elon Musk.
Elon Musk? Oh, well, Elon Musk styles his hair after me.
Oh, okay.
All right, remember, he's from Mississippi, right? And oh, Tiger Woods. Oh my gosh, folks, it's horrible. I have been trying to get Tiger Woods to come here. He's had 7 back surgeries, still addicted to painkillers. If he had come to Deuk Spine, honest to God, I would have fixed him the first time, and he would be still winning the golf tournaments. It's so sad. The problem is these people have no clue that Deuk Spine Institute exists. That's why we do our streams, to raise awareness. All right, I'm just about finished trying to get these last pieces of herniation. He's got a really bad injury to his disc at 6-7. It's a miracle I was able to get into it. Honestly, if I had just started this surgeries years ago, I would not even try in his case because it's too difficult. But I am able to get in there and get rid of most of this herniation. Some people are surprised we cannot, as surgeons, get rid of all the herniation, but we can get rid of about 50 to 80%. 50 to 80% removal of a herniation is all you need to give a patient no symptoms. And I've cleaned out the tear. Take a look here, guys. You guys see we got a couple of pieces of herniation right there. 3 of them that we've saved for you guys to look at. Okay, you see that, Henry?
Yes, we do.
By the way, the surgery is basically bloodless. We have probably 1 cc or 20 drops of blood loss. Everything looks magnified because you're looking down a tube with an endoscopic view that's magnified. All right, let's take that away. I'm going to show you guys the incision. Oh, there's some more herniation there. Let me have another Raytech. The incision is literally 4 millimeters. There's no metal put in. There's no fusion. There's no artificial disc. There's nothing unnatural put in the body. And there it is. You guys see this? Let's have the tape measure. I want to show you this. It's a 4 millimeter incision. Okay? And he's going to go home in an hour. No hospitalization, no metal, no fusion. It's an amazing surgery. Our success rate is 95%. We eliminate on average 99% of your neck pain with this surgery when it comes from a disc. And the recovery is immediate, just 1 hour. You can go back to normal stuff the next day, including work. You can fly home the next day. We have people traveling from all over the world. Our next surgery is going to be a Deuk plasma rhizotomy of the SI joint, facet joint, and a piriformis release. Okay, thanks for joining us. I'll be right there. Let's show one of our testimonials. Type up your questions. I'm going to come talk to you guys face to face.
I'm here with my patient who traveled from California, Northern California. He had a herniated disc at C5-6. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that is really nice procedure, and the staff here is really nice. They're always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today, when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much. You know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Deuk laser disc repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later. Feeling good, huh?
Well,
With
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have is not going in earlier and living 18, 20 years with pain. For me, it's been 3 years since July of 2020. It's been miserable because I've been with pain. And I've been told by doctors, let's just take time. I did all kinds of physical therapy, acupuncture, you name it, everything that's out there, and nothing seemed to help. And today, with 1 day of getting something really that's gonna be for life, it's amazing. It's a smile of joy, you know? If you are going through this trouble, don't hesitate on sending your MRI. When I did it, I sent my MRI for free review, and my answer was, yes, you are a candidate. Here I am today, flying back with literally no pain on my neck and no numbness on my hand, which I miss that. It's awesome.
It's wonderful. Now, what is your native tongue? What is your native language?
It's Spanish.
Are you from Mexico originally?
Guadalajara, Jalisco, Mexico.
Guadalajara.
Yes.
One of my favorite songs. Can you tell them in your native tongue how you feel?
Yeah. Quisiera decirles que si están teniendo problemas con una hernia en su cuerpo, manden su MRI, es gratis y les van a dar un resultado, una verificación si ustedes son candidatos. No vivan con dolor, porque el dolor les va a causar toda la vida, y los doctores allá afuera les dicen que no hay solución, pero las soluciones existen, simplemente las tienes que buscar y creer, tener fe que tú vas a estar mejor. Si Dios te mandó a este mundo es para que vivas bien, no para que vivas con dolor. Así que te recomiendo que por favor tomes esto en serio, hagas ese paso de mandar tu MRI gratis y habla ya sea con quien tengas que hablar para que ellos te empiecen a guiar y te digan qué es el siguiente paso que tienes que tomar. Así que una recomendación con Dr. Deuk. Muchas gracias.
Muchas gracias, amigo. And Feliz Navidad.
Feliz Navidad. Gracias.
Safe travels, my friend. Thank you so much for sharing.
And good morning, I'm Dr. Deukmedjian at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple. And afternoon, good morning. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who traveled from California with a problem in his neck. He's been having pain. It radiates down into his left arm. He has some other issues as well, like pinched nerves in the elbow and palm, which he's treating in California. But the herniated discs at 5-6-6-7, we did the Deuk laser disc repair yesterday. You can see me going in with the endoscope and the laser. It's all done with a 4mm incision, bloodless surgery, and outpatient. And here he is less than 24 hours later, and he wants to share his story with you. So go ahead.
Okay, so the first thing I want to do is give Dr. Deuk a joke that I wrote last night. He's going to understand this. We might have to look some of these things up. A neurosurgeon was performing several radiofrequency ablations on patients when he started hearing loud shouts and screams in the recovery room. Shocked, he walked into the room to see what happened. The nurse ran up to him. "Doctor, things got pretty heated up for a while, but no one had the nerve to say anything." That one over there seems especially nerveless. All right, so I got him to laugh.
I like
Good
it.
stuff. Okay.
I like it.
You know, just a
Nerveless
little
instead of
dad
nervous.
humor there. Good
I
stuff.
love it. I love it. I love it.
What happened for me was ever since I was a kid, I was the young kid that fell off the high chair when I was 2 years old, fell down the staircase when I was 4, got tripped, hit the back of the sandbox at 6. I went in the military. I parachuted out of planes, hit my head more than once with a Kevlar helmet, then served in the military wearing Kevlar helmets, sometimes banging my head against heavy artillery pieces. Sometimes I didn't have my helmet on. Sometimes just the weight of the helmet was hurting my neck and my back.
That part about banging your head in the plane against heavy artillery pieces, sometimes you hear in the military like a helicopter went down, right? Suddenly exploded, went down. Now I know why.
Well, you know, I mean, people will say, why would you jump out of a perfectly normal airplane?
Right?
But, you know, let me just tell you, low contour flying by sea, some of the jets there makes things a little bit tough. And then after that, what I started to notice, I started to develop where my muscles in the back just became really severely tense and stressed out. I kind of thought it was work, and otherwise. And then when I'd go to things like the dentist and I'd lean my head back, my entire left arm would just start tingling and sparks shooting out like crazy. And when I got back up, things were better. But then I went on a trip back in early May, and then it was happening all the time. At that point, I got an MRI done. You know, obviously at that point, I went to my primary care and I had options. There were 5 options, really, if you think about it. One was do nothing, just, hey, I'm getting older, just deal with it. You know, stop being a baby and just, you know, life goes on. Number 2, maybe seek physical therapy or chiropractic care, which I did, and it helped. For some things, I had really bad posture. That was one of my issues, but it wasn't taking away the problems that I was having with the tingling doc. So then I started to seek out medical expertise in Los Angeles. First choice was full disc replacement for both.
All right, what a lovely testimonial from our patient, but we wanted to get to your questions. I'm Dr. Deukmedjian. We used to do these Q&As face-to-face at the end of surgery all the time, but we've gotten a little busier and changed our format up. But we wanted to do another one today, give you the opportunity to talk to me, asking questions, and getting my answers. I could use some models. We have lots of spine models here too. I'll show you one spine model right here. This is the cervical spine, and this is the part of the body we just operated on. Basically, the skull sits here on top of number C1. All right, C1 has a name. It's called the Atlas. The Atlas. It's named after the Greek mythological figure, Atlas, who held the world on his shoulder. Remember him? So Atlas is C1, and just below C1 is called the axis, C2, because C1 rotates along the axis. It allows rotation. 50% of your rotation side to side of your head happens at between C1 and C2. The other 50% happens down in the subaxial spine. Again, I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. You have just watched anterior cervical transdiscal endoscopic Deuk laser disc repair, our version of laser spine surgery. Our goal here today was to go to the back of the disc and remove the herniation using a laser, doing as minimal damage as possible to the patient's body. That we succeeded in. The only damage we did to his body was to make a small 4mm cut in the skin, which, I mean, gosh, if you cut yourself with your razor blade, you probably bleed more than that. But internally under the skin, there was no damage. We spread the tissues with a dilator and we did not cut anything. We got to the disc, we spread the annulus, went through it, went through the jelly, got to the back of the disc and used the laser to remove the herniations. There were about 25 pieces of herniation I took out. You could go back and watch them. They're floating up the tube, coming out of the body. Some of them I had to grab and pull out with the grabber because they were too big to float out. All right, we have questions.
Yes, we do. First one from Facto, once more on YouTube,
Facto.
asking, will you do revisions on previous ACDFs?
So the question is, would I do a revision on a previous ACDF? If it's necessary, absolutely. If it will benefit the patient and help them, I will do it. Not a problem. I can do a revision ACDF. Remember, I have done 1,000 ACDFs, artificial discs in the neck. I've done 500 PCDFs, which is laminectomy instrument fusion. So I've done 1,500 fusion and artificial disc surgeries on the neck spine alone in my career of 30 years. That's a lot. I stopped doing them because the laser is far better than any type of fusion. But I'm happy to do a revision as long as it benefits the patient.
And then lastly, from user, once more on YouTube, asking, what is the advantage of laser that cauterization? Are they any weak points of laser surgery, such as fragility to injure vertebral artery or root? I am a Korean spine orthopedic surgeon. Thank you for your great surgery, Professor.
Well, thank you. And it's an honor for me to be talking to you today. Thank you for joining our channel. It was the Koreans, the South Korean, Dr. Sang-ho Lee, Dr. Gan Choi at Woodydal Hospital, who taught me the transdiscal endoscopic technique you just watched, going from the front, going through the disc to the back, and removing the herniation. Dr. Sang-ho Lee and Gan Choi, they used the metal grabbers to do their surgery, and you saw that I use the metal grabbers, but I also use the laser. The laser is the most precise instrument for removing unwanted tissue in the body of any other type of instrument. Now, the laser is so precise that 99.9% of surgeons don't even use it because it just removes too little tissue at a time. However, when precision matters, and as a surgeon, you want the least invasive surgeon that targets just the tissues that are very small, the size of a pea, then you use the laser. But you must use the laser endoscopically, because if you use the laser with loupes or with your eyes or glasses, you're not going to be able to see what the laser's doing. You must have an endoscope. You must be able to magnify. And with the endoscope and the laser, I can remove tissues right on top of the nerves and spinal cord up to 1/20th of a millimeter. There is no other instrument in the world in surgery that allows that much precision and accuracy. 1/20th of a millimeter is how precise the laser can be when used endoscopically in the way that I use it. It has never caused nerve damage at Deuk Spine. It's never caused spinal cord injury. I've never removed any tissue I didn't want to remove. I have very precise control over the laser, far better than any other instrument. Thanks for asking.
That is it for questions.
Any comments?
No comments.
All right, thanks for joining us. We will be back shortly with a patient who is from the islands. She has horrible back pain. You're going to see this gigantic incision on her back because she had a huge fusion done in the past for her back pain. Now she's developed adjacent segment disease affecting the SI joints on both sides. She has SI joint pain, she has facet pain at L5S1, and she has piriformis muscle tears on both sides. So we're going to start with the facets and SI joint. We're going to do what's called the Deuk plasma rhizotomy to kill the 5 pain nerves to the SI joint. Then we're going to treat her piriformis muscles on both sides with our piriformis release that I pioneered and patented here at Deuk Spine Institute. It's the least invasive, most successful piriformis release available in the world. There is almost no bleeding, and the incision is only 4 millimeters. Thanks for joining us. We'll be back shortly.